I would say the most common things we see are sprains and strains.
Okay.
And probably equally as common are overuse injuries.
Okay.
I think that in my clinic, I see more overuse injuries than sprains and strains because the overuse injuries tend to happen sort of gradually, and so they can make an appointment and see me kind of at their convenience.
Right,
Whereas
right.
the sprains and strains often need to be seen that day, so they go to the ER or an urgent care center. So I think my population is skewed a little bit more towards the overuse injury.
What are some of the more serious injuries that an athlete can sustain at a young age? Of course, you hear all about concussions or broken limbs and bones. What are probably the more serious ones that you have seen?
I would say concussions are pretty serious. We've had a few this year where kids have been out of school for several weeks because of their concussions. So fractures, torn ligaments that might require surgery. So those would probably be the most serious orthopedic injuries that we see.
Have you seen the more serious injuries occur with more frequency? Have you seen more patients with more serious injuries as of late, or is it pretty steady?
I would say it's been pretty steady with the exception of concussions. I will definitely say I've seen more concussions in youth football this season. But I don't know that necessarily means because there's more happening. I think what it is the media has brought so much attention to this that they were not being recognized before. And now coaches and parents are more aware of the symptoms, and pediatricians are more likely to be aggressive about treating them and send them to a specialist. So I think that's why I'm seeing more of these kids in my clinic. I'm not sure it necessarily means that they're more frequent, that concussions are more frequent.
Okay.
Although I think it's a good thing that they're coming to see us.
Right. What are some of the effects of concussions, long-term and short-term?
Well, short-term effects of a concussion really span several different categories of brain function. So you can have physical symptoms such as headache, nausea, dizziness, balance problems, visual disturbance. You can have disturbances in your emotions. So people will often be very emotional or very irritable. You can have disturbance in your sleep patterns. People have difficulty sleeping at night. It will disturb their their sleep rhythms. And then lastly, their cognitive function. So they'll have significant problems with memory, concentration, which is one of the main reasons why we keep them out of school.
Right.
So it can affect multiple areas. And then in terms of long-term, I think we don't know all the answers yet as to what the long-term effects are. But we have definitely seen some recent studies showing that after several concussions, we've been documenting on certain neurocognitive test batteries that people who have had multiple concussions score a bit lower than people who have had one or no concussions in their past history. So, and then there's also some evidence on imaging studies that maybe it's leaving some structural damage in the brain. But unfortunately, those imaging techniques are kind of experimental now. So you can't just go to an ER or a hospital and have one of these things done. So they're just much more powerful magnifying lens that they're using to look at things.
And this is
better MRI. Right. So there's two pieces of evidence. One is there's this project led by a neurosurgeon in Boston, Dr. Cantu, who he's trying to collect on autopsy brains of former NFL football players and college football players once they've passed away, and look at those brains under the microscope. And what he's found is there's some very consistent findings in terms of structural abnormalities. And so that's one piece of evidence. The second piece of evidence are these neuroimaging techniques that are being used are starting to see tiny little abnormalities in the structure of the brain as a result of concussion. And so the thought is that the current definition of a concussion is it's a functional injury to the brain, not a structural injury. But I think we all agree that it's just there may be a structural injury, but we just don't have the power to see it with our current imaging tools.
Right.
So I think that is one of the problems in communicating this injury to the public and to a patient. It's very difficult for them to understand that they could have an injury if nothing is showing up on a scan.
Right.
And so I think, if nothing else, it may help us both make the diagnosis and convince a patient or family, a coach, that this is real. You have an injury here.